Are you a medical provider or the owner of a medical clinic that is strictly cash-based and are struggling to convert your patients into paying patients because they're so used to insurance? Let's talk about that today. Kevin Ware, your Action Business Coach, and I work with a number of medical practices that are strictly cash-based. They don't do insurance or they do minimal insurance. And one of the things that I find is that when a clinic switches over from an insurance-based business into a cash-based business, there's a struggle to convert prospective patients into actual patients. Because let's face it, if somebody has insurance, we all know they're not making the financial decisions. So it's easy for them to say yes to your medical services if it's covered by insurance. But when we move over to cash, the psychology completely reverses, that now the patient has to pay out of pocket themselves for pretty much everything, and our you as a provider actually switched over mentally on that. A lot of providers aren't there yet. So let's walk through, how do I sell a patient in a cash-based practice to actually spend their own money on a treatment plan with you, the medical provider. So the first thing we have to take a look at is you need to understand your own value proposition and make sure to communicate it out clearly to your marketplace. Here's the thing, you know you're good. You know what skills you have and how well you can treat the patient. The question is, does your marketplace know that? Because if you're just going out there as doctor ... and I do ... and ... does that really communicate a value proposition for that patient? No, it doesn't. So one of the things we have to do is know what our value proposition is. I have a unique ability to heal this with this technique, done it for X amount of years. And then if you know your own value proposition, how well do you get that out to the marketplace? Is it on your website? Is it on all of your marketing materials? Is your team communicating that effectively? As too many medical professionals still just go out there and says, hey, I'm Dr. So-and-so, come on in and use me. Doesn't work in a cash-based practice. So understand your own value proposition and make sure you communicate clearly. Number two is you need to have a defined process on how you convert that prospective patient into a paying patient and write it out. You see, the problem is that when you're just strictly an insurance-based business, you just fly by the seat of your pants. Here's the insurance form, sign away. The thing is that without a defined sales process, you're going to find that the patient is not effectively communicated with. You go through a diagnosis and you said, let's get you on board, and you're kind of winging it and there's no process written out, and all of a sudden you're not converting any patients. Why? You have to make sure that you're guiding them through a decision-making process that has defined steps that guide you and them, and they need to know what that looks like so that they can visualize making that decision for themselves and for their treatment. So write that out and practice it. So number three, you need to make sure the patient knows what we call features, advantages, and benefits. So what are features? Features are basically, what is the uniqueness of our clinic? What sort of technology are you using? What sort of techniques do you use that's different from everybody else? What is that treatment plan or treatment device? What's the features of that? Number two, what are the advantages of using this treatment plan, this device, this software, this process? They have to understand, okay, that's the advantages, and therefore what are the benefits? Are you going to heal faster? Do you have an 80% higher rate of healing on certain muscles, or certain this or certain that? What are those benefits, and can you illustrate them so that the patient can totally understand? What are the features, advantages, and benefits of your treatment protocol, plan, device, or whatever? Okay, that's number three. Number 4, probably the most important thing is we have to basically convert the patient on emotions, not just logic. You see, it's really easy in the insurance world to use 80% logic on, here it is, this is what treatment is. When you go into a cash-based practice, now the emotions come out. I have one of my mentors that said this, and you can apply this into your medical practice. I do the logic, they do the emotion. We have a logical process that solves an emotional problem. Think about this. The patient is having emotional problem. They are in pain. They are not feeling well. They have immense amount of discomfort. That is an emotional issue with them. You may think of it as logical, but for them, it's an emotional problem. You have a logical solution. So the whole idea is that the logic makes them think. The emotions make them act. So you have to start getting through when you're in that final process to develop a treatment plan. They have to feel the emotion of what would it mean to them if they are healed. How will their life improve? What will it mean to them? If you strictly go on logic, people they won't have that emotional decision-making process, and they will go right back to the habit of finding somebody on the insurance world who will do something for them, but probably they can't do because you have that uniqueness. So you have to integrate those emotions into the process. And then number 5, work out the best possible financing plan with the patient. Now, do you offer care credit? Can you put together an internal financing plan? What are some outside the box ways that you can enable that patient to pay for what you are offering? Now, do you want to be your own accounts receivable and collection agency? In an ideal world, no. Might you do that for some patients? Yeah. I don't like chasing around money, and you don't like chasing around money. But if it's a patient that maybe doesn't have enough upfront cash and they maybe have a credit crunch, but guess what? If you treat them, they're going to be the greatest salesperson for you and bring lots of referrals in potentially. Yeah, you might want to make some arrangements for that. So think outside the box. So let's cover all 5 of these points once again. If you're a cash-based practice, you need to understand your own value proposition and make sure you're communicating clearly. Number 2, have a defined process that you guide the patient through to make a decision. Number 3, make sure your patient knows the features, advantages, and benefits of getting treatment from you. Number 4, sell on 20% logic and 80% emotion. And number 5, work out the best possible financing plan with the patient. So let's talk for a second. If you are a cash-based practice owner and you're struggling in this area, I want you to book a call with me, either a 15-minute phone call or a 30-minute strategy session. Let's talk some things through. Let's go ahead and figure that out. I'm not going to sell you anything. It's not who I am. I want to help you, the medical practice owner, get the most out of your practice. Now, if you want to look at ongoing coaching sessions in the future, that's fine. But let's talk now. Let's get some of those problems solved. Go out there and make it a great day.